There's a window of opportunity in our biology that lasts about 10 years, a silent period where your body gives you the chance to intervene before something irreversible happens. And yet most of us close the curtains on that window simply because we're ashamed to look down. According to the world's leading authorities in gastroenterology and oncology, colorectal cancer is now one of the most preventable malignant diseases, with an almost 10% chance of avoiding a fatal outcome if we act in time. And you can start this prevention now, not in a complex laboratory, but in the privacy of your bathroom, observing what your body expels. I know it may seem strange to start a conversation talking about this. It's embarrassing, I admit. Even for me, who has studied human physiology for years, there's a social barrier that prevents us from talking about the health of our feces at the dinner table or with friends. But it's precisely this silence that is killing thousands of people every year. Before we continue, I need to be very transparent with you and give you an important warning. I am Robert Tournier, an educator and researcher dedicated to prevention and longevity. The content I will present here is purely educational and informative, based on the most current scientific evidence. This video does not, under any circumstances, replace a medical consultation, a formal diagnosis, or clinical examinations. My goal is to equip you with knowledge so that you can have high-level conversations with your trusted doctor. That said, I want to share something personal that changed my perspective on this topic. Recently, during one of my research projects on longevity in centenarian populations, I came across a case that deeply affected me. Not of a distant patient, but of someone very close to my circle of acquaintances. Someone young, healthy, and active, who ignored subtle signs for months. This person, let's call him Carlos, to protect his identity, began to feel mild fatigue, something he attributed to overwork and modern stress that, oh, I just need to sleep more on the weekend thing. The problem is that, along with the tiredness, there was a subtle change in the bathroom, something he didn't notice. He flushed and went on with his life. Stay with me until the end of this video, because the outcome of Carlos's story reveals exactly the mistake I don't want you to make, and which, unfortunately, almost cost me dearly at a point in my life when I neglected my own gut health. The truth is that our gut is not just a food processing tube. It's a complex ecosystem often called the second brain, and when it tries to communicate with us, it uses a very specific language. The shape, color, and consistency of what comes out of us. Ignoring the toilet is ignoring the most accurate daily report on your internal health. Colorectal cancer, which is the uncontrolled growth of cells in the large intestine or rectum, doesn't appear overnight like a sudden heart attack. It's a slow developing disease, often starting as a small polyp, an internal wart, so to speak, that can take years, sometimes a decade, to transform into something malignant. And here lies the tragedy and the hope. If we find this polyp early, the disease simply doesn't happen. But to do that, we need to overcome our disgust. We need to understand that feces are composed of water, bacteria, undigested fiber, and dead cells, and the proportion of these elements tells a story about your hydration, your diet, and crucially, the integrity of your intestinal wall. The current scenario is alarming and demands our immediate attention. Global data shows that although medicine is advancing, we are seeing a frightening phenomenon, an increase in the incidence of this type of cancer in people under 50, an age group that doctors previously considered safe. Recent studies published in major scientific journals indicate that the modern lifestyle, characterized by high consumption of ultra-processed foods, sedentary lifestyles, low fiber intake, and chronic stress, is accelerating the aging of our gut. We are inflaming our intestinal mucosa daily, creating fertile ground for errors in cell replication to occur. And the most dangerous thing is that, in the early stages, when a cure is practically guaranteed, the symptoms are vague, nonspecific, or completely non-existent. That's why tracking and self-observation are so important, which is what we call body literature. You need to become the greatest expert on your own functioning. When I talk about prevention, I'm not just talking about getting tests done when the doctor orders them, but about adopting a proactive stance, a life engineering, where you understand the risks and act before the problem arises. Medical science today is clear. Colorectal cancer is, to a large extent, an environmental and behavioral disease. Genetics plays the cards, but it's your lifestyle that holds the power. If you have a family history, you should be extra careful, but even without a family history, no one is immune to the consequences of an inflammatory diet and a neglected gut. Let's delve a little deeper into the issue of fecal engineering. What comes out of you is the end result of the entire metabolic process. If transit is too slow, the stool becomes dry, hard, and difficult to pass, indicating that it has been exposed to the intestinal wall for too long, allowing the reabsorption of toxins that should be eliminated. If transit is too fast, it comes out liquid, preventing the absorption of vital nutrients. Balance, that ideal shape that we will discuss in detail later, is a sign that your microbiota, the trillions of bacteria that live in you, is in harmony with your human cells. Losing this balance is the first step towards dysbiosis, an alteration in the intestinal flora that has been strongly linked to the development of precancerous lesions. Many people ask me, Robert, but I feel fine. I'm not in pain. Why should I worry? The answer is simple and frightening. The intestine is a visceral organ that, in many parts, has little localized pain innervation in the way we feel it on the skin. A tumor can grow silently, taking up space, bleeding microscopically, without you feeling a single cramp until it's too late. That's why looking at the toilet bowl is an act of courage and self-love. It's a daily visual scan. And I know that modern life is hectic, life in fast mode, but I invite you to slow down in this intimate moment. This pause for inspection can be the difference between an early diagnosis, resolved with a simple procedure, and a complex fight for life. In this video, we're going to crack that code. I'm going to teach you how to read the signs, understand the Bristol Smear Scale, the most widely used visual diagnostic tool in the world, and recognize when normal is no longer normal. But before we get into the graphic and technical aspects, I need you to make a commitment to yourself now. The commitment to leave embarrassment outside the bathroom door. What happens in there is health, it's biology, it's life. And if you think this topic isn't for you because you're young, remember Carlos, my friend I mentioned at the beginning. He was only 38 years old when the first signs appeared, signs he ignored because he thought cancer was an old person's disease. Preventive medicine, which is my passion and area of expertise, is based on anticipation. We don't want to put out fires. We want to prevent the spark from happening. And in the case of the digestive system, the spark is chronic inflammation and changes in bowel habits. If you notice that your bowels used to function like clockwork in the morning, and suddenly, without any change in diet, they become irregular or alternate between constipation and diarrhea, this is a cry for help from your cells. Don't normalize discomfort. Don't normalize bleeding, thinking it's just a hemorrhoid, without being absolutely sure. In medicine, doubt should always be investigated. We're just beginning this journey into the interior of our bodies. In the next few minutes, I'll detail exactly what you should look for, what the warning colors are. Yes, color matters a lot. And what shapes indicate that you need to schedule an appointment this week. Get ready, because the knowledge I'm about to share with you is the most powerful tool you have to ensure your longevity and quality of life. Now that we've broken the ice and understood the vital importance of observing what comes out of us, I want to introduce you to a tool that's practically a GPS for your gut health. In medicine, we like to standardize things so that everyone speaks the same language, and that's how the Bristol Scale came about. Don't worry about the fancy name. Think of it as a menu of 7 types that classifies the shape and consistency of stool. And I invite you now to do a visualization exercise with me, without disgust, approaching this as pure science and self-knowledge. Our goal is to identify where you fit in most days, because consistency tells us a lot about how long food has been traveling inside you. If the journey was very slow, all the water was reabsorbed and the stool dries out. If it was very fast, the water didn't have time to be absorbed and it comes out liquid. Let's start with the extremes, which are the signs that traffic is congested. The type 1, those hard, separate little balls, similar to nuts or goat droppings that are difficult to pass, are a sign of dehydration and lack of fiber, indicating that the stool has been stalled in your large intestine for too long, fermenting and releasing toxins. Type 2, it's similar, but the little balls are joined together, forming a lumpy sausage shape. Both types signal constipation. And why is this dangerous in the long term? Because stagnant stools mean prolonged contact of carcinogenic substances, which are in food waste, with the wall of your intestine. It's like leaving toxic waste leaning against the wall of your house. Over time, the paint will peel and the structure will suffer. Moving towards the middle of the scale, we arrive at what I call the gold zone. Type 3, it's a sausage with some cracks on the surface, and the type 4AA, type 4, is the holy grail of gastroenterology. A sausage or snake-like shape, smooth and soft. That's how a healthy, happy gut should function. This shape indicates that you're well hydrated, eating enough fiber, and that the transit time is perfect, neither too fast nor too slow. It's physiological balance. If you look at the toilet bowl and see type 4 frequently, congratulations, your biological engineering is operating at peak efficiency. But the scale continues, and we enter the acceleration zone. Type 5, they are soft pieces with sharp edges, easy to pass through. The type 6, they are fluffy, ragged pieces, a soft paste. And the type 7, it is completely liquid with no solid pieces. These last types, from 5 to 7, indicate urgency, rapid transit, diarrhea, or inflammation. It could be something occasional, like food that didn't agree with you, but if it's chronic, it could indicate malabsorption, food intolerances, or inflammatory bowel diseases. However, my friends, here comes the crucial point of our conversation today, the detail that often goes unnoticed in the traditional Bristol Stool Scale, but which is the biggest warning sign for colorectal cancer. The change in caliber, that is, the thickness of the stool. Remember Carlos, whom I mentioned at the beginning? What he ignored was not only the consistency, but the shape. He noticed that suddenly his stool started coming out thin, like a ribbon or a pencil. He found it curious, but not worrying. This thinning of the stool is a very serious mechanical sign. Imagine the intestine as a flexible tube, like a hose. If something grows inside this tube, taking up space, like a tumor or a large polyp, the space for stool passage decreases. The result is that the stool is shaped by this obstruction, coming out thin and flat. If you notice this happening persistently, it's not time to panic, but it is time for immediate action. This is not normal for age. This is not stress. This is an indication that there may be a partial obstruction in your intestinal tract, and your doctor needs to know about it as soon as possible to investigate. Another point we need to address seriously is color. Blood in the stool is perhaps the most frightening sign, but it's not always bright red. Yes, bright red blood on toilet paper can be hemorrhoids or fissures, which are benign problems, but it can also be a tumor in the rectum, the final part of the intestine. However, the greatest danger often lies in blood that you don't see as blood. Tumors in the upper intestine, in the right colon, often bleed a little each day. This blood travels, is digested, and turns the stool dark, black as tar, and with a very strong and characteristic odor. This is called melena. If you see very dark stools and are not taking iron supplements or have eaten beets, this is a medical emergency. And we can't forget the systemic symptoms, those that affect the whole body. Cancer is a disease that consumes a lot of energy. Tumor cells are voracious, they steal nutrients to grow. Therefore, unexplained weight loss is a classic sign. If you're not dieting, haven't increased your exercise, and yet you're losing weight, your clothes are getting loose, pay attention. Carlos lost almost 8 kilos in 4 months and received compliments from friends. Wow, you're in great shape? He accepted the compliments without realizing that his thinness was his body being consumed from the inside. Along with weight loss comes fatigue, a tiredness that doesn't go away with a good night's sleep, often the result of iron deficiency anemia caused by that occult bleeding I mentioned. Anemia in adult men or postmenopausal women is, by medical definition, suspected to be due to gastrointestinal loss until proven otherwise. Your body doesn't stop producing blood for no reason, and you don't lose iron for no reason. If your blood test shows anemia and you are experiencing weakness, shortness of breath when climbing stairs that were once easy, dizziness upon standing, don't just rely on vitamins. Ask your doctor, "Doctor, why am I anemic? Where am I losing this blood from?" This simple question can save your life. It's the difference between treating the symptom and discovering the root cause of the problem. Furthermore, pay attention to the sensation of incomplete bowel movement. You know that urge to go to the bathroom, you go, but it feels like nothing comes out? Or a constant urge, called tenesmus, which is painful and unproductive? This happens because the tumor can irritate the nerve endings in the rectum, tricking your brain into thinking there's still stool to come out, when in fact, it's the tumor mass itself that's there. It's an uncomfortable and distressing sensation that many people hide out of shame, suffering in silence for months. I know that talking about all this can generate anxiety. It's natural to feel a chill in your stomach thinking, could I have this? But I want to transform your fear into power. Knowledge is the light that scares away the monsters of the dark. When you know what to look for, you stop being a passive victim of chance and become the guardian of your own health. Most of these changes can be caused by much simpler and less serious things, such as irritable bowel syndrome, diverticulitis, or hemorrhoids. But the one who will give this verdict is the healthcare professional based on tests, and not Dr. Google or your assumption. What I'm asking you to do here is to get out of autopilot. We live in this so-called accelerated life, swallowing food without chewing, rushing to the bathroom with our cell phones in hand without paying attention to our bodies. This detachment from our own nature takes a heavy toll. Your gut speaks to you every day. The question is, are you listening? Stay with me. I'll tell you the ending of Carlos's story, and more importantly, I'll give you a practical roadmap of what to do from now on. We'll talk about screening, about colonoscopy, which isn't the monster it's made out to be, and about lifestyle changes that protect your gut. We've reached the moment of truth, where we need to tie up all the loose ends. You must be wondering, and Carlos? What happened to him? Well, Carlos's story has a bittersweet ending which serves as the biggest warning I can give you today. When he finally overcame his stubbornness and shame to see a doctor, the diagnosis was confirmed. Stage 3 colon cancer. The hemorrhoid he thought he had was actually a bleeding tumor. The fatigue was severe anemia, and the thin stools were a partial obstruction. Carlos survived, yes, but at a very high cost. He had to undergo complex surgeries, have a significant part of his intestine removed, and face months of chemotherapy, a process that wore down not only his body but the emotional health of the entire family. Today, he is doing well, in remission, but he always tells me, "Robert, if I had done that exam 5 years earlier, or if I had looked at the vessel carefully at the beginning, I would have resolved this with a 20-minute procedure and gone home for dinner." And that's exactly what I want for you, to solve the problem while it's still small, or rather, while it's not even a problem yet. The great magic of colorectal cancer prevention lies in an exam called a colonoscopy. I know the word is scary. There's a stigma, tasteless jokes, and unfounded fear surrounding this procedure, but I need to demystify it now. A colonoscopy is not just a diagnostic exam. It's a therapeutic act, a minimally invasive preventive surgical intervention. The doctor inserts a flexible tube with a high-definition camera while you're sedated, and believe me, it's the best nap you'll ever take. You feel absolutely nothing. No pain, no discomfort. You only wake up when it's all over. During this journey through your intestines, the doctor is hunting for the villains of the story, polyps. Think of polyps as small warts, little fleshy growths on the intestinal wall. Most of them are benign at first, but over time, some specific types, adenomas, can mutate and become cancerous. The beauty of colonoscopy is that upon finding a polyp, the doctor doesn't just take a picture, he removes it right there and then. He cuts the problem off at the root. By removing the polyp, he interrupts the timeline that would lead to cancer. That's why we say this cancer is preventable. If we remove the polyp today, the cancer doesn't exist tomorrow. It's simple and fascinating biological math that works in favor of your longevity. But when should you get this exam? The guidelines have recently changed due to the increase in cases among young people that I mentioned earlier. Previously, the rule was 50 years old. Today, the American Cancer Society and many strongly recommend starting screening at age 45 for the general population. If you have a family history, father, mother, or siblings who had the disease, the rule changes. You should start 10 years before the age your relative was when they were diagnosed. That is, if your father was diagnosed at 48, your screening should begin at 38. Talk to your doctor about your personal risk. There are also less invasive screening tests, such as the fecal occult blood test, which is a chemical test to detect blood invisible to the naked eye. It's a great initial screening tool, widely used in public health programs, but remember, if it's positive, a colonoscopy is mandatory. Beyond screening, there's daily prevention, the kind you do with your fork and knife. Your gut is literally shaped by what you eat. Fiber is the great forgotten hero of the modern diet. It acts like a broom, sweeping away toxins and speeding up intestinal transit, preventing harmful substances from remaining in contact with your mucous membrane. We're talking about eating real food, fruits with peel, vegetables, whole grains, oats, seeds. And of course, hydration. Fiber without water is cement. Fiber with water is a soft sponge that cleans everything. Reducing the consumption of processed meats, sausages, bacon, ham, salami, is also crucial, as the World Health Organization has already classified these foods as confirmed carcinogens for the gut. The message I want to leave engraved in your mind today is about intentionality. Living a life with more intention and less haste means stopping treating your body like an unbreakable machine. It means looking at the toilet not with disgust, but with respect for the biological engineering that keeps you alive. It means losing the fear of scheduling an appointment and having a test that can ensure you're here, healthy and strong, to see your children grow up, to enjoy your retirement, to fulfill your dreams. Prevention is not about living in fear of disease. It's about living with the certainty that you are doing your part to protect your most precious asset. And since I know this topic is surrounded by taboos, and that many people suffer in silence out of shame to ask, I have a very special request for you now. I want to create a chain of protection here on the channel. Think of two people you love, two people who are over 40 or 45 years old, or someone who constantly complains about their bowels, and share this video with them now. Send it to your family on WhatsApp. You don't need to say anything embarrassing, just say, I watched this video and thought of you, it's worth watching. This simple act of sharing can be the push someone needs to schedule an exam that will save their life. Be your family's health advocate. And before ending this video, I saved a golden tip. Here's a small anatomical biohack you can apply today that changes everything. Did you know that the way we sit on the modern toilet is biologically wrong? Sitting at a 90-degree angle, like in a chair, creates a curve at the end of your intestine, an elbow that makes it difficult for stool to pass and forces you to strain unnecessarily. And excessive straining increases the risk of hemorrhoids and prevents complete emptying. The secret? Elevate your feet, use a small stool, a stack of books, or even the tips of your toes to raise your knees above hip level, simulating a squatting position. By doing this, you straighten and align the anorectal angle and create a natural slide. It's simple physics applied to physiology. Try placing a footrest today. You'll notice that bowel movements become faster, more complete, and effortless. It's a small change in routine, but a huge one for the long-term health of your pelvic floor. If this content resonated with you, if it brought you clarity or raised an important alert, I invite you to subscribe to the channel and activate the notification bell. But why activate the bell? It's not vanity on my part. It's because the YouTube algorithm understands that if you subscribed and activated the bell, this topic is relevant, and it will deliver this video to more people who need to hear this message. By subscribing, you are helping to educate the algorithm to prioritize health and quality science instead of empty entertainment. Join our community of people seeking longevity with intelligence. I'm going to leave 2 video recommendations here on the screen that perfectly complement what we discussed today. One is about anti-inflammatory foods that protect the gut, and the other is about how emotional health impacts your digestion. Continue this marathon of knowledge, because learning about yourself is the best investment there is. I am Robert Tournier, and my sincere wish is that you have a long, prosperous, and above all, healthy life. A life in Mode X with more intention and less haste. A big hug, and see you in our next video. Bye.